So I don't think it's a surprise to anyone that the rate at which Step 1 and Step 2 scores have been increasing year over year is not sustainable. There were a lot of benefits of Step 1 going to pass-fail. It took a lot of pressure off to a degree, but now medical students have less that differentiates them between other classmates, other applicants, especially for highly competitive fields, dermatology, plastic surgery, neurosurgery, etc. The people that have access to testing study resources that allow for scores this high, the students that have access to research resources that allow for 40, 50, those are real numbers, publications or research experiences that allow for you to match in neurosurgery are limited. This concept is not new. If you are at Harvard versus a small state MD school versus any DO school, or if you are a IMG or an FMG, you are going to be at a significant disadvantage. This is one of the charts that I always think about when I see attendings that are like, kids these days, they don't work as hard as we do. Step 2 first aid resources were not that long. They are much longer now. The average score in 1995, the year I was born, would not even have you pass Step 2 in 2024. I want you to think about that. That's half of the people who took Step 2 in 1995 who were an average medical student. Most medical students today are average medical students. They would not even pass today. And I feel like that is something that should concern everybody. I see medical students that are applying for not super competitive fields like emergency medicine. My field's not super competitive to get into. And they are concerned that they are not going to be a standout applicant with a 250 on Step 2. And I know it's a big ask because the people reading these applications are faculty attendings. They have lives, they have families, they have other career goals. But it's why as an institution, as a medical institution, we need to prioritize soft skills. I would 10 times out of 10 rather have an applicant from a lower tier medical school with exceptional social skills rather than someone who got a 280 on Step 2 but doesn't know how to break bad news. Do you know how to have a conversation with a patient who doesn't agree with your treatment plan? Are you able to deal with pediatric patients, people with disabilities, elderly patients? I don't care how many retrospective chart reviews you did or PCRs you did, or how many times you reprinted the same kind of research experience at a different conference to double count that publication, which is a real thing people do. If you're not able to be a person